Hello everyone, I am Saroj Topno, MBBS intern in Rajendra Institute of Medical Sciences, Ranchi, Jharkhand. So before we start this video, let's just imagine that you are on a hike, enjoying nature, when suddenly you feel a sharp pain in your leg. Yes, there's a snake bite. So whatever happens next could be matter of life and death. So in this video, we are diving into everything that you need to know about a snake bite and what are the types of snake, what are the symptoms of snake bites, and most importantly, how to respond effectively. So stay tuned because this information could save someone's life. So in this video, we're gonna talk about most common snakes across the country, which are dangerous. So what I saw in emergency department, there are two types of snakes. One is neurotoxic and the second one is hematotoxic. Under neurotoxic, snakes are number one is cobra and number two is crate. And whereas when we talk about hematotoxic, the snakes that come under this category is number one is Russell viper, second is saw scale viper, and third is green pit viper. Yeah, so now we know there are two types of snakes, so we should know now what are the symptoms that are caused by these snake bites and how should we distinguish it and manage it effectively. So now we'll be talking about what are the symptoms caused by snake bites. As we already know, there are two types of snakes, neurotoxic and hematotoxic. So we'll be talking about neurotoxic first. So yes, neurotoxic, there are two types of snakes, cobra and crate. So if you are bitten by any one of these snakes, what symptoms you will experience? You can experience severe body pain and also body paralysis can occur. So first, check eyes if there is ptosis or the patient is complaining of diplopia. Most importantly, neurotoxic snakes can lead to respiratory paralysis. So keep this in mind. Before patient goes into respiratory paralysis, we have to give patient anti-snake venom. Yeah. So when we talk about hematotoxic snakes, what are the symptoms that one person will get if they are bitten by hematotoxic snakes? Before we talk about symptoms, we need to know that hematotoxic snakes can cause bleeding, hemorrhage, coagulopathies. So what are the symptoms they'll come with? We'll see is bleeding from that fang mark. Second, when we try to put IV line, we can see bleeding, blood in urine. At last, we can also see blood in stool, epistaxis, bleeding from gums. Yeah, this all can happen. We also have to keep in mind that this Russell viper, they are renal toxic snakes, so they causes renal failure within hour. So patient can develop oliguria, hyperkalemia, and they might need dialysis. So now when we know what are the types of snakes, what are the symptoms of snake bite, we also should know how we distinguish that a patient is bitten by which type of snake. So what we do is 20 WBCT, 20-minute whole blood clotting test. In this we take a glass container. It can be a test tube or it can be a vial. Yeah, it can be anything. So second is we take 2 to 3 ml of venous blood from patient in that glass container and we leave it undisturbed for 20 to 30 minutes. After that, we check for any blood clot. We will tilt that glass container or we will invert the tip and see if there is a blood clot present. So that means it is a negative test, and that means there is no coagulopathy. And if there is no blood clot, that means there is positive test, coagulopathy is present. So what does it mean? The presence of coagulopathy is a key indicator of major poisoning from some species. Yeah, so this we do in emergency. So if there are facilities, we also go for sampling such as CBC, bleeding profile, as we know that Russell Viper leads to renal failure, so we also go for RFT, urine analysis. We also go for LFT. Yeah, these all tests are to be done. And now we'll be talking about what are the effective response that we should do when a person is bitten by a snake. First we have to do is reassure. 70% of the snake are non-venomous and only 30% of snakes are venomous. Sometimes patients are so worried and so much anxious that their sympathetic hyperactivity increases their heart rate, and this is one of the most common causes of mortality in these patients. Second is we have to clean that bite mark with just water. Third is immobilize that limb. Wherever the snake has bitten, immobilize that part. How to immobilize it? Just like any fracture site we immobilize. We have to make a splint and you have to wrap a bandage over that. Splint can be anything. It can be a rod, it can be a cardboard, it can be wood, it can be anything. The main purpose is to immobilize the limb which is bitten. And do not wrap the bandage so tight that it occludes your arterial and venous supply. That can be more dangerous. So it should be tight enough so that only superficial lymphatics are occluded, not the arterial and venous. Now we'll talk about what not to do when someone is bitten by a snake. Most common mistake that people do is they will tie tourniquet around that limb. They will cut the wound and try to squeeze the blood out, or they will suck poison out of the wound. This all we have seen in movies, and let me tell you, this all is wrong, and this leads to even more harm to that person. So first, I'll tell you why we should not tie tourniquet. So if we tie tourniquet, there will be arterial and venous supply will be cut off, and there will be edema of the limb. So what I saw in emergency is whenever there is snake bite, people always they tie tourniquet and come to hospital. So this is what movies has done to us. So we should know why we should not tie tourniquet, and if someone has come with tight tourniquet, so we should not open it suddenly, because there will be a sudden gush of poison into circulation. So what should we do in that case is, wherever the tourniquet is tied, above that we will place BP cuff, and we will inflate it till systolic blood pressure. And then we will slowly remove the tourniquet and then deflate the BP cuff, so that the poison or the supply goes into circulation slowly and the body copes up with that. We have to do this. And next is we have to first of all shift to hospital and check for ABC. What is that? That is airway, breathing and circulation. So we also have to ask patient to count single breath count. Why we are doing this? Because we very well know now that neurotoxic snakes causes respiratory paralysis. So if they are bitten by neurotoxic snakes, they won't be able to do this test, single breath count. We tell them that in single breath you have to count from 1 to 30. Yeah, if there is respiratory failure, patient will fail to do this. So now we'll talk about how should we manage such cases. So first, if the patient is in shock, we have to treat that. Second, we have to decide if the patient has been bitten by a venomous snake or not. So after we get to know that the snake was venomous, we have to start anti-snake venom serum. And this serum is obtained from other animals, so it can cause allergies in some patient. So how should we give this? We should take 50 ml of anti-snake venom serum and dilute it in 500 or 1000 ml of normal saline or dextrose saline, and give through IV, slow IV infusion. Anti-snake venom can cause allergy. So before giving anti-snake venom, we can give antihistamine, and we always have to get in hand adrenaline and hydrocortisone before we start anti-snake venom, because they can cause allergies. So we have to have this in our hands. So if patients develop anaphylactic reaction, so in that case we have to stop anti-snake venom, and then we have to give histamine, um, we have to give adrenaline, hydrocortisone, and then again after some time restart anti-snake venom, and keep the patient in observation for 24 hours. If the patient is bitten by neurotoxic snakes like crate, cobra, in those cases we also give atropine and neostigmine. Yeah, and uh, keep the patient in mechanical ventilation if they have gone into respiratory paralysis. Patient, those who are bitten by hematotoxic snakes, they might be bleeding, so we have to give them appropriate blood components. So at last, I would like to talk about how do we find out from fang marks that the snake was poisonous or not. So we have to see that fang mark. If there is two teeth mark, so most commonly the patient might have been bitten by a poisonous snake. And if there are multiple teeth mark or scratch marks, so most commonly they are non-poisonous snakes. Yeah, this is one of the uh, things that we see as soon as the patient come, and to identify what kind of snake was the one that bit that patient. Yeah, so that's all about snake bite. What are the types of snake bite, symptoms and treatment? I hope you like this video, and thank you for watching this video.